event fully. And we will be very happy if you could introduce yourself in the chat, to see who are here and who is asking the questions and who are taking part in the discussion. Thank you. Дорогие друзья, пожалуйста, выберите.
Dear friends, please choose interpretation channel. We will start in just 2 minutes. We will start our side event. So we are all here. Thank you for joining. Please choose the language that you prefer, Russian or English. We will have simultaneous interpretation today. And if it is possible, please introduce yourself. So your name, city, country, and organizations that you represent. Thank you very much. I'm very happy to see you all here. Hello, from Georgia, Ekaterina. I represent a Georgian organization for women who use drugs. We are very happy to see you. Hello.
Мы сейчас попросим вас заполнить первый.
Now we will ask you to answer the first question that we have for you. So why we ask you to do that to see which types of organizations you represent. So we have this small poll for you. It is like introduction. Like if we had face-to-face meeting, we would have a round of introductions, like who represents which sector. So our technical team will help us now to start the first poll. For our session. So I want to remind you that you have joined a side event on critical situation with the rights violation of women using drugs in Eastern Europe and Central Asia. And we are starting our session today, and we will start with a poll. I hope that now you will see it on your screen.
So we are starting the session, and I'm welcoming all participants on our joint event of Alliance of Public Health and Eurasian Harm Reduction Association in the United Nations Commission on Narcotic Drugs 2021. And this side event is dedicated to review and analysis of critical situation with rights violation of women using drugs in Eastern Europe and Central Asia, and what actions and what immediate actions are required. So we are now starting the discussion, and we wanted to start it with the questionnaire to all participants. I hope that technicians will help us with this. There are several questions, and we're asking what organization you are representing for us to know who are in the audience. And this ministry or central authority, central governmental authority, state authority, state agency on health or social care, law enforcement authorities, NGO providing harm reduction services, or maybe community organization of people who use drugs, or maybe NGO providing assistance to survivors of violence, and we hope that they're here, regional or international organizations, maybe you are expert on human rights or drug policy, or maybe some other, we don't know. And please choose one and submit the answers. We will see who is in the audience. Thank you. And one more time, while you are choosing and we are getting results, please choose the channel you will use for today's meeting. There is the Russian and English interpretation. So please choose the channel the most useful for you to take part in the meeting. Hopefully we could see results now, who we are in the in the room who are here, whom we are welcoming here. No, I can't see results. Hopefully you all can see. And now I'm introduced. Oh, we could see. And we have rather diverse participation, and we are welcoming all of you from state and non-state organizations, and from regional and international, and from experts, and even the organizations who are providing help to survivors in the case of violence. Welcome, everybody. I'm Hanna Dovbach, Eurasian Harm Reduction Association. I will facilitate this meeting. And actually, we will have two parts of the meeting. One, analyzing the situation with the gender-based violence and all the human rights violations in Eastern Europe and Central Asia. And then we will move to action and reacting and addressing these cases, what experience we have in the region and what need to be done in it further on. And from the very beginning, I'm giving the floor actually to Victoria Kaliniuk from Alliance for Public Health, who is providing us with a review of human rights violation among vulnerable groups collected through REACT database in 5 countries of the region: Georgia, Kyrgyzstan, Moldova, Tajikistan, and Ukraine. Victoria, floor is yours.
So thank you very much. I'm very happy to participate in today's event. Just a second, I just need some couple of seconds. Okay, yes. So I'm happy to participate in today's event and share with you data collected through REACT instrument in 5 countries. So basically, REACT is an online tool to record human rights violations by communities. It's community-led monitoring and response. REACT allows to document and to respond to legal barriers and human rights-related barriers that people living with HIV and groups at risks face with when accessing health services, confronting law enforcement agencies, or just in their everyday life. In Central Asia and Eastern Europe, REACT now covers 7 countries, over 40 cities, over 80 NGOs, and over 130 reactors. Reactors that are people who are normally social workers or outreach workers, and they are documenting cases, and they are skilled to provide primary legal support to the victims. I encourage you to visit REACT website to find out more about REACT itself and to find out evidence and data collected through the instrument in our countries. So talking about countries of today's presentation, I will speak up about Georgia, Moldova, Kyrgyzstan, Tajikistan, and Ukraine. So these countries have different period of implementation. Here you can see months of implementation. Countries have different scale of implementation, different number of regions, different number of NGOs, and different number of reactors. But anyway, we can analyze collected data and we can understand the situation in particular country. So speaking up about women who inject drugs, you can see that the percentage in the total number of clients registered in REACT is quite small. So in Georgia, it is just 6% of clients. They are women who inject drugs. In Moldova, 15%. In Kyrgyzstan, 6%. In Tajikistan, 5%. And in Ukraine, 24%. So working in our countries, we try to involve reactors from different key groups and to see the overall picture in the country. But unfortunately, women who inject drugs are still very low number in REACT among our clients. And there are some reasons for that. So first of all, criminalization of drug use and possession of drugs for personal use makes these people to hide, and especially women who use drugs. They are very hard to reach with services and with help, especially with human rights related help. The second reason is that women who inject drugs are less likely to go to NGOs and to seek for services in NGOs. And another reason is that women who inject drugs are less likely to fight for their rights because they do not have support, and they do not have sometimes even permission from their husbands and sexual partners for these to claim their rights, to protect their rights. So normally they are just somewhere in the shadow. So talking about some most frequent types of violations. So here you can see numbers of types of different violations which happen with women who inject drugs in 5 countries and during the whole documenting period. So you can see that 33 cases of domestic violence had been recorded, but basically this is just the top of iceberg. We are sure that domestic violence occurs much more frequently, and there are much more victims of domestic violence. Women just don't dare to to report violence, and even though they dare, they they less likely to receive adequate response from police and adequate protection. Also, we have recorded in Tajikistan a lot of cases of domestic violence caused by family members and relatives, and very often drug users are evicted from their homes, and they have to live on the street, even closer to street drugs. A lot of cases of stigma and discrimination were recorded in every country. You can see that stigma and discrimination, this gray part in every country, is quite big, and this stigma and discrimination because of drug use is overall in all spheres of the life. Also, we have recorded cases where children of women who inject drugs were subjected to stigma, discrimination, and bullying at their schools by other pupils or even by teachers. Then these red numbers, they show us cases where perpetrator is police or law enforcement. So you can see that arbitrary detention happens quite often, and also it's important to mention that arbitrary detention often occurs at the exit of OST sites. In the countries where suspension of treatment is allowed for a couple of days, we have recorded cases that police was confiscating and convicting OST patients for drug possession, even though these patients had all documents that prove that this is treatment. Also, it's important to mention that women who inject drugs, they are more vulnerable during detentions by police, because normally police using violence against them, police forces women to give evidence against her partner or other drug users. And especially a very strong argument in such conversations between police and women who inject drugs is that police can manipulate of this woman using children. So threats of deprivation of parental rights, or threats to go to social services and claim about this woman. This is very strong argument to press the woman. Then these green fields, you can see these are perpetrations caused by healthcare system. So we have recorded a lot of cases of barriers in accessing OST, especially during quarantining restrictions. So there were a lot of cases in May, June 2020 in Kyrgyzstan, when restrictions of movement were implemented in such way that they didn't took in account this need of everyday visit of OST sites by patients. Also, we have recorded a lot of cases of absence of OST treatment and lack of treatment in countries like Moldova or Ukraine. And a lot of cases registered which show us humiliating treatment in medical facilities, and this attitude keeps patients far from healthcare system and keeps them far from prevention and treatment. And talking about response to violations, so here you can see general percentage of case status of all these 5 countries, and you can see that quite a big part of cases are solved rather positively than negatively for a client. So response is provided directly to the client. And for example, in Ukraine, 85% of cases were solved using resources of local NGO, local reactor NGOs. That is a very good scale of services in local NGOs. Another big problem we face with is that client doesn't want to resolve the case. So having a big set of services of legal support, of paralegals, clients are afraid to claim for their rights, to protect their rights, and they prefer just to hide in the shadow and not to proceed with their cases. And this is what we should work in to bring more awareness to our clients about their rights. And just very shortly about response we provide too. So it's a response on the individual level and referring to other NGOs or institutions for the help, immediate help to the victim. Another strategy is to collect several cases which are about the same problem and advocate this problem, solving of this problem on the local level. And the third strategy is to use evidence and data collected through React tool to advocate changes, legislative changes of the laws, of practices on the national level. We prepare reports of data, of statistics we collect every half a year in every country, and these reports are used for some advocacy actions and legislative assessments. So from my part, that's all. I'm very happy to be able to share this stunning information and stunning numbers on such a high level. Thanks.
Thank you, Vika, and thank you very much for international team who are working to document these cases and to react on these cases. And congratulations on the big job you are doing. And actually, we are moving to the one more situation analysis because which caused by emergency situations. And actually, I will ask Svetlana Moroz from Eurasian Women's Network on AIDS, who are gathering information and could share the situation from community point of view and from the specialists on emergency situations such as COVID-19 and war conflicts. What is happening, what's changing in the violence among women living with HIV, vulnerable to HIV, using drugs, and what community response is effective and possible in the situation of emergency where unfortunately we are all in now. Sveta?
Thank you, Anya. Do you hear me well? Dear colleagues, my name is Sveta Moroz. I want to share my perspective as community activist, women's rights defender with experience of substance use and life with HIV. I am also an ex-hepatitis C patient and internally displaced person. Oh, sorry. I can list my... Oh. Due to neglect of women who use drugs, problem situation in country have more negative impact on them than on the rest of the population. Due to response measures to COVID-19, OST centers are being closed by states and activities of service NGO were temporarily banned. These measures also affected the economic situation of women who use drugs, places them in even more dependent situation on men, which increase the risk of involving them in criminal activities against their will. To get permission to continue working in the context of pandemic, community organization sought to independently communicate with the authorities directly and to explain how important it is not to interrupt the provision of HIV prevention services. We are aware about the case when outreach workers were fined for rendering harm reduction services. Violation of confidentiality. Next slide, yeah. Violation of the confidentiality of OST and IRT clients' personal data, including HIV-positive pregnant women, is one of the most serious problems caused by the introduction of quarantine measures. Again, not doctor, but the community organization came to help clients to communicate with police officers and checkpoints. In Georgia, Kyrgyzstan, Moldova, and Ukraine, it was possible to get the medication for several days. This was done as a result of communities' persistent demands from the outset of the pandemic, preceded by the years of advocacy for changes to the national substitution therapy protocols. But the provision of OST medication for several days for stable patients did not resolve all problems. Firstly, the women clients who recently entered the program were classified as unstable by the medical staff, were forced to come to OST sites daily, being exposed to both the risk of being infected with the coronavirus infection and the risk of being detained by the police for violation of the self-isolation regime. There is no anti-discrimination legislation, no state-supported mechanism of monitoring human rights violation or gender-sensitive integrated support services for women who use drugs. Moreover, state themselves encourages discrimination and stigmatization of women who use drugs by means of criminalization, zero-tolerance policy, and repressive gender-blind drug policy in general. Limited support provided mostly by NGO, which also face different political and legal barriers. The armed conflict in Ukraine has worsened the risk of sexual, physical, economic violence faced by women who use drugs. It has also negatively impacted women's access to essential health care, including HIV and drug dependence treatment. The plight of women who use drugs was further aggravated by the fact that almost 1 in 5 had to change their place of residence due to the military conflict. In 2018, almost half of the community-led study respondents did not have enough financial resources even to buy food. The unemployment rate was significantly higher than the regional averages. The armed conflict most likely has resulted in the IRT interruptions. More than 40% of survey respondents living with HIV interrupted therapy for some time after 2014. Women using drugs are an invisible group for most UN mission and human rights organizations working in the armed conflict zone in eastern Ukraine. Many women are also torture survivors and are therefore in need of specialized services. No one works with them on their traumatic experience of torture or other violence. Besides the closure of OST programs, some women had to endure beatings and illegal detentions due to drug use and participation in OST programs by militants in self-proclaimed republics. For more than 40 months, the HIV-positive drug-dependent women activist Natasha Zelenina, internally displaced woman is detained in the occupied territories. On December 2019, she was sentenced to 11 years of imprisonment for drug contraband. The buprenorphine pills of substitution maintenance therapy was legally received by the woman as prescribed by a doctor narcologist at the Vinnytsia Regional Drug Dispensary in Ukraine. Women who use drugs and women living with HIV are especially vulnerable in case of hate-based violations because of repressive governmental approach, discrimination and criminalization of women from this group in countries of EECA region. There is also an issue of shrinking space for communities in our region. The legislation is getting tougher in Russian Federation, putting in danger the community's work at the country level and women activists on everyday basis, helping other people in documenting human rights violation, in protecting their rights, and in advocacy for access to HIV services for women using drugs and living with HIV. Eurasian Women's Network on AIDS as a regional network are deeply concerned about this situation and requesting support for security. We are lacking clear algorithm for ensuring safety of the women activists. In order to develop such tool and to train activists to use it, we need technical support from international organizations who are more experienced in this area. Thank you for your attention.
Thank you, Sveta, and we all work hard to free Natasha Zelenina and to provide support to all your colleagues and to all our colleagues in the staying in the hardest position in the emergency situation and in war conflict. It's hard to continue, and actually now when you seeing all of us seeing a review of the situation, the more general and now in deep with the interviews and very hard interviews and quotations from community members who are suffering the most. I want to ask you, because we are now in the point of going to the reaction part, to what we could do practically in the ground. Could you please answer some question from us? What could be done, in your opinion, if you would plan activities to respond the gender-based violence and violence against women using drugs? What you would do in your country? I hope that technicians will show us the questionnaire now. From your opinion, if you will be free to allocate resources to this topic, to what priorities you would allocate resources? First, to offer safe shelter and services in each crisis center, or shelter for survivors of violence. Second, and you could choose several options which you see as a priority. Offering safe space or shelter in the separate accommodation or shelter for women who use drugs specifically, separately. Third option, it's activities of police and law enforcement to investigate cases of violence and punish those responsible. Fourth option is to provide rehabilitation and substance abuse treatment for women who is victim of violence. Other option to adopt or to adopt if this woman could have the parental rights, and maybe to send children to the orphanage for the while or for ages. It's a bit provocative questions, but still a lot of countries doing this. Maybe you as our audience think that that's priority. Call into action, that's English translation, and then no action. And actually that's very frequent request. There are too many and we can't react. Let it be as it is. Sorry for having such hard questions, but that's the reality. Maybe you will find what would be priority for you, and we will see what audience is thinking about it. We will now see results of the questionnaire, how we'll all see the immediate action which needs to be done addressing the violence. And we could see that majority of our respondents are in the case of providing either place for shelter and safe space and support for victims in the shelters for women, or specific shelters for women who use drugs with a specific approaches to provide help and shelter, or and I guess and it's not or activities of police to ensure justice and punishment for those who are responsible for human rights violations. And there are 42% who want to provide or to offer rehabilitation and substance abuse treatment for women who is victim of violence. So we could see results, and now we will go to the actions which we suggest and which international organizations and national police and activists are already providing and how they develop these activities. And we will go to the presentation from Eurasian Harm Reduction Association specialist Maria Schiatre, who will present our regional initiative, which is done actually together in cooperation with the Alliance for Public Health and Eurasian Women's Network of AIDS, addressing lack of shelters. And actually the project is and the presentation will be on regional overview of problems and recommendations for organization service for organizing services for women using drugs experiencing gender-based violence. Maria, floor is yours.
Thank you, Anya. Can you hear me? Can you hear me now? So I'm going to speak Russian now. And so if you need to switch your channels, this is high time to do that. As it has been mentioned by the previous colleagues, I believe that we've clearly stated that the situation of gender violence among girls and women in the backdrop of the COVID pandemic is just aggravating, and women who use drugs, they are fall victims of gender-based violence 5 times more often than women in general. Sveta and Victoria have already mentioned some problems for women injecting drugs regarding access to services. Let me mention just several of them. So I believe that it is very important to keep in mind that even harm reduction programs that would be entry points to receive services in the situation of violence for women injecting drugs, that often they are inaccessible for those women, because even harm reduction programs, they are not sufficiently focused, oriented to needs of women. For example, there are no childcare services and women have nowhere to leave their children, and there is no time allocated where women can come and safely receive these services. And it is also important that under harm reduction programs, often there is no staff who are experts in the theme of violence, and the organizations lack algorithms on how to respond to situations of violence. Women in the situation of violence where they inject drugs, it is also difficult to have access to services of other organizations that provide support for women in those situations. This is due to the fact that in such organizations, often there are stigmatizing attitudes, discriminating attitudes to these women, and lots of shelters and crisis centers, they just do not admit women injecting drugs and women on OST, undergoing OST therapy. Children may be a barrier, or HIV positive status. There are hotlines where it is possible to call, but often they don't have information about what they need to tell to such women, how to support them if they inject drugs. And it should be mentioned that because of criminalization of drug use, instead of protection and support, women may encounter the sentences and deprivation of parental rights. So in this context, when we speak about organization of services and support for women injecting drugs, those who have experienced survived violence, it is very important to focus on safety of these women. Actually, it doesn't even matter if they have that experience of injecting drugs or not, but it is important that they have adequate support. These services need to be adaptive and accessible, and thus they need to reflect the needs that women currently have. Obviously, this is a range of services because women may need security, So we may need to work to ensure her security or medical care. It is important to provide psychosocial and legal aid services, re-socialization if needed. In order to ensure that, it is important to develop partnership among the different organizations. Here we speak about public and non-governmental organizations. So here it is important to work with harm reduction organizations and those that work and that support women in situations of violence. And the last statement there is that we actually speak about 3 layers of this kind of work. First, this is about prevention of violence. We need to work with the women so that they could identify that was experience of violence. It's important to work with their partners, with their families. Second layer, this is providing assistance to the woman and protecting this woman, and all of these services need to be focused on the needs of the women. And the last layer, it is the legislation and the implementation of legislative provisions so that the services were available and accessible for those women who experienced survived violence and who use drugs. And now, thank you.
Thank you very much, Maria, and thank you for this project, and thank you all the partners and experts who are starting this hard work, connecting harm reduction and providing shelter to women who use drugs. I need to comment on one of the comments. Sorry for this provocative questions. I take full responsibility. Unfortunately, in some of the countries of Eastern Europe and Central Asia, you have seen violence from police, as well as this structural violence and violating rights, parental rights of women using drugs. Unfortunately, these cases are rather often, and I will give you a link in chat on our applications and submitting and reports to human rights UN treaty bodies on the cases of violating parental rights and reproductive rights of women using drugs, in case specifically when they are approaching police or approaching social services in case of violence. Unfortunately, these cases are used, but we absolutely against this practice. And we actually doing everything in working with police and law enforcement to avoid, and social services to avoid these practices and to change these practices. And now actually that's a good link to show the best practices of police response and experience responding to violence in the Ukrainian system and Ukrainian police. And we are very happy to have Olena Dashutina here with us. Olena is head of Department of Monitoring Gender Equality and Combating Domestic Violence, and she's coordinator of it at the Respecting Human Rights Office in National Police of Ukraine. Olena, floor is yours, and actually what could be done from the police?
Good afternoon. So I would like to tell you a little bit how the national police works. So the national police in Ukraine, so we have changed the laws on domestic violence, and in 2017, Ukraine transformed the laws, expanding the circle of people who are covered by such laws. And we received some new mechanisms that we can implement today in countering domestic violence. So in 2017, we had a pilot project. It was called Polina, and It was a network of mobile groups to respond to domestic violence cases. So they worked in 3 pilot towns, Odessa, Kiev, and Severodonetsk. And when those mobile groups were working, there were no changes in the legislation yet back then, but it allowed us to see the key issues which police saw in terms of domestic violence. So some personal problems, some subjective attitude to certain situations, and see more systematic issues and the legal problems and legislative problems, like why certain things could not be done. So these mobile groups included police officers from different departments, investigators, juvenile prevention officers, district police, and these activities proved to be quite successful and effective. And when new legislation was approved based on the data that we collected through the work of such mobile groups, we were able to approve certain regulations of more practical nature, regulating the work of police and expand the activities of mobile groups throughout the territory of Ukraine. In September 2019, we had 45 mobile groups working in all regions of Ukraine. So today, we have those groups working at the sectors to counter domestic violence in each region, and we will increase the total number up to 50. So the main response algorithm, so how do those groups work, and how does police respond to the cases of domestic violence in cooperation with the other partners? So after we receive a call reporting a case of domestic violence, so the operator, based on the situation, sends a mobile group or patrol police. So if we have a mobile group which is available, so the operator would send this mobile group, or patrol police can also be engaged. Or even if in case if it's about domestic violence, if patrol police goes to the scene and sees that we have domestic violence, they can also engage the mobile group. So the mobile group, the first thing they do risk assessment. They want to understand the existing risks, and based on such assessment, they make a decision on further action. So maybe they would engage investigators if there is a criminal offense, and the national police informs the responsible coordinator, who is responsible at the level of the ministry for coordinating any interactions in response to domestic violence. So what are the powers of police in this area? First, that's fact-finding and responding to the cases of the domestic violence. Second thing that we do, we receive and review like reports of domestic violence and notifications. So people can call or come to the police office and tell about cases of the domestic violence. The third thing is informing victims of their rights and of the services available for them if they suffer from domestic violence, and the possibilities that they have in the social sphere and in the legal environment. Also, those are restrictive orders against offenders. So when police officers come to the scene of domestic violence, they do risk assessment, and they can make a decision to issue a restrictive order. So it has several ways to influence the offenders. So the offender can be requested to leave the premises, not to come close to the victim. So one of those methods can be used, or both can be used based on risk assessment. And this order can be implemented for 1 or 10 days. And if the offender does not comply with this order, police would come and then there would be administrative responsibility against the offender. The next component is putting the offenders to a preventive register and implementing preventive measures. And the next component is a monitoring of the implementation of special measures such as restrictive order. The seventh component is revoking permits for the right to acquire, keep, and bear arms and munitions, as well as their seizures. And number 8 is collaboration with other actors in the sphere of countering domestic violence. So if we talk about the data on domestic violence, we can say that in 2020, the National Police registered 208,000 reports on domestic violence, among them over 11,000 of physical violence, 125,000 of psychological violence, and 1,200 of economic violence. And there were 41,000 of the restrictive orders. So this mechanism started to be used just recently. And so now we have a criminal responsibility. There is Article 126-1, and we have already 1,669 criminal cases, and we have a separate register for children who commit domestic violence, because we also do preventive activities for such offenders, and we see the statistics here. So we have 240 children registered. So that is how the police responds to the cases of domestic violence. Thank you for your attention.
Sorry, I'm speaking muted. Thank you very much, Elena, and actually for your great work, and it's very innovative for the region, and hopefully we could arrange more discussion and training for different police departments in the countries to learn how to address and not to be the cause of violence, but to be the response to violence. Thank you for this. And I see questions, your questions to Olena, as well as for the questions on Istanbul Convention, and there is the huge discussion in the chat. But now I will give floor to Alla Bessonova from Kyrgyzstan, activists who have her responses, and activists actually now united, and a lot of women showing their faces and going with their voices to respond to the violence. And we want to hear from Alla her experience and experience of the group of women using drugs who are openly react on the violence and developing the shelters for their friends and comrades. Please, Alla, floor is yours.
Аня, thank you. Мне хорошо слышно, да? Нормально?
Can you hear me well? Yes, we can.
Dear colleagues, my name is Alla Bessonova. I thank you for opportunity to present my view on the situation of women who use drugs related to violence in Kyrgyzstan. I have experience of drug use, and then I myself had to go through all forms of violence. 50 years have passed. Unfortunately, even today, the level of violence against women is still high. A successful practice of work to combat violence, let me introduce WINC's model, which is being implemented within Kyrgyzstan since 2013. The model is a collection of key elements of interventions that's allowed to be applied in the context of shelters, crisis centers, community-based NGOs, and almost any other organizations delivering assistance to those who had survived it. After appropriate adaptation, various versions of this model have proven to be effective in assisting women who use drugs. This model Wings of Hope, who prefer to receive assistance by single window method when the entire range of social, physical, legal services is provided in one organization. This model Wings Sunflower. This mechanism relieves women from necessary to find herself, the people responsible for ensuring her health and safety, which is particularly important for low-income women of those who have children on their hands. The changed drug scene poses new challenges. We have now started to develop the next version of Intervision Wings NPS that specialists trained to the methodology could provide more effective services to prevent domestic and gender-based violence to women who use NPS. The methodology allows a more important algorithm for working with the immediate environment with specialists of emergency medical team and with law enforcement agencies. The criminalization of acquisition and personal possession of drugs for personal use leads to abuse by the police, as well as it makes difficult and impossible to report on the facts of violence. Extortion, coercion to collaboration, refusal to provide access to state-guaranteed legal assistance. There are cases of youth withdrawal syndrome in order to obtain information which is equal to prohibition torture. The women, when faced with violence, are almost unable to use the legal instruments of protection and look to the protect by other state guarantees that are designed to protect us. The difficult situation of women who use drugs as well reflected in result of conducted research within country. Next slide, please. In context of COVID-19 crisis, the level of domestic violence has increased for the whole country. All crisis centers were filed or did not take any applicants due to the quarantine restrictions. During the period of the state emergency, the number of applications to friendly organizations for a safe house among women who use drugs increased by 3 times compared to the period before the state of emergency. Next slide, please. The important laws have not been adopted in Kyrgyzstan. There is no support to work of mechanism for the protection of women who face with intersecting form of discrimination in accordance with the national law on protection against domestic violence and existing bylaws. The state, for its part, continues to support intolerance and repressive attitudes toward people who use drugs. The adopted standard for the application of the anti-discrimination approach are implemented in crisis centers based on NGOs that operate in situation of lack of funding, services, and specialists. De facto, women who use drugs are not admitted to other crisis centers for women affected by violence. Next slide, please. And it turned out that women who use drugs are particularly vulnerable where there is violence due to the repressive state approach, discrimination, and criminalization. In the vast majority of cases, women rarely write complaints against violenters, fearing repeated violence, pressure from the police, and investigative bodies, based on the court that ultimately result of more lenient sentences for perpetrators. Activists in Kyrgyzstan are concerned of inaction of the part of the state and key services providers to change the situation concerning women from key groups who have experienced violence, organize events to highlight the theme of violence against women. But in the authoritarian patriarchal authority, this sparked a wave of outrage. We hope that thanks to possible cooperation and assistance from international organizations, women who use drugs can obtain all possible services in situations associated with violence. Activists and women organizations can obtain technical support to organize their own security. Thank you.
Alla, thank you very much for your intervention and actually for doing what you're doing with the narco-feminists and with all activists and opening your face even in participating in this webinar could be dangerous with the names and faces. And we appreciate it very much. And your voice is very valuable and very needed to all of us internationally. Thank you for this voice. Actually, dear colleagues, formally we're already 5 minutes late, and for those who need to go to the CND session, please go. But we have some time, having luxury to have interpretation for some questions, answers, and discussion. And thank you for your active participation in the chat, in discussion. But I still will ask Elena Dashutina, having her here, this question which Elisa raised in the chat and Anton was trying to respond. Do you see, Elena, any role of police on advocating or providing arguments for ratification of Istanbul Convention by Ukrainian parliament or by authorities? What could be done and how could we work together on this?
Thank you for the question. We already received the requests from the Parliament of Ukraine on the position of the national police on Istanbul Convention, and almost all positions of Istanbul Convention are actually taken into account in our laws, which were transformed just recently, and we need to think how to implement other provisions into our legislation. So on our side, on the side of national police, we do not have any objections. So we actually gave our suggestion that we support ratification of the convention.
for this response actually, and that's unique situation when law enforcement supporting the convention implementation in the country. Thank you. And we have raised hand from Ola Belaeva from Input. Ola, please.
Thank you very much. Thank you, girls, for your presentation. Alla, Sveta, I am with you. And I want to say that we always say that the first thing is safety, but it is difficult to ensure safety and security from a government agency, from police. So we have Yelena from the National Police today with us. It is great that people are joining and they are participating in the discussion. Maybe you can tell us how we can live, how we can speak out, how can we talk about our problems, but at the same time continuing to use psychoactive substances and ensure our safety from the system which is prosecuting us, because it looks like there is no way out. But maybe you think that there are some platforms where you talk to colleagues from other countries. So what do you think about it? Can there be any cooperation?
Floor is yours again.
Thank you for your question. You know, the National Police acts in line with the Ukrainian laws. So unless we have certain key changes in the legislation, so we cannot change our actions because we comply with the laws. That's one thing. The second thing is that from our side, we organize certain events for police officers, police representatives to make sure that they do not demonstrate their subjective attitudes to certain situations, so that we try to raise their awareness on certain things. Of course, we cannot get into the head of every police officer, but today we see big changes in the attitude. It's not only about the situation that we are discussing today, but in general, about a range of issues. So we organize trainings, but if we talk about the legislation, that's not exactly my level to talk about changes in legislation. But if we have an opportunity, we try to be engaged in the process and give our suggestions to the changes in legislation. So I couldn't say that nothing is changing. I think that the situation is changing, maybe not so quickly as we would like, but still change is happening. Thank you. It was important for us to hear that you also initiate the change, because that's approach of European police officers, because when they see that the national policies, they do not allow certain changes, they initiate
Thank you,
such
Olena,
changes.
for this discussion. It's really good to have you all here in the session. And actually, we all saw that we have more problems than solutions, and maybe some other participants will want to step in to share some solutions. And I have hands from Vitaly Rybinchuk and from OF Victoria. I don't know your name. Hopefully Victoria, but maybe not. And we will go for very short interventions from you, and then we will close the session. Please, Vitaly.
Thank you, Anna. So Vitaly Rybinchuk, Eurasian Network of People Who Use Drugs. I would I'd like to thank Maria from EHRA for her presentation, because she was really talking about the aspects where we have issues. When I say we, I'm associating myself with other participants of the conference. And I would like say that, in fact, why we have such a situation. In my experience, I see that in some countries, reactors do only one thing. They document cases, though in fact reactors or paralegals can and should, when they see human rights violations, violation of women's rights, and if they see that there is a possibility like at the legislative level to organize certain mediation and intervene, I think that such opportunities should be used, because who is the closest to the case, who can respond to it? Because we have a lot of formalities, and when the case goes to law enforcement agencies, like the response can be delayed and the initial situation can aggravate greatly, so that women can be in such a situation that they just want to get their issue resolved. They just want to forget about this case. So I think that it would be really good to make a focus on training paralegals, training reactors in mediation, so how they can use mediation mechanisms. And the next thing I wanted to say is that when I saw that many people voted for rehabilitation in the poll, I actually voted for the first two options. Because in harm reduction programs, there is already a certain approach to have low threshold and friendly services. And just what has to be introduced there is the gender aspect. So this aspect should be introduced and developed. That's the only thing which can be done. And if we are talking about rehabilitation in facilities like in Ukraine, there were research studies done by Volna, the network of people who use drugs, and they showed that services offered in rehabilitation services centers, they are not friendly. Not in all of them, but in many of them. And they are often high threshold. So they do not really look like the services which are provided in the government sector. Like when a person is told, when he comes to the rehabilitation center, he is told that you should quit smoking. Though in the standards of service provision, it is told that you can not smoke anywhere, but there are special places for smoking. And another thing is that in Moldova, for example, an OST patient cannot enroll into a rehabilitation center. So this is a barrier, and such services cannot be called friendly services. And also rehabilitation centers, they do not have this practice when people can leave the centers for certain periods of time. Though like in Europe, even in detention facilities, based on certain criteria, like administration can see that a person already demonstrates desire to change and intention to change, and a person can leave the detention center for a whole day. But when in our countries people come to rehabilitation centers, so they have to stay in the center. If they leave, they cannot come back. Because I can speak a lot, like 600 words a minute for 24 hours.
Are working hard in our meeting. And sorry, Vitalik, I will speak English to be consistent for all the participants. We will take one more replica question from the OF Victoria. I don't know how to talk to you. If you are still here, please show up and say who you are and ask your question, and then we will go to speakers to finalize the meeting. The floor is yours. Who is there?
I'm not sure who you are, Victoria, but if you are speaking, please unmute yourself. Yes, I'm speaking. Unfortunately, I do not speak English. So my question is quite simple. Could you please introduce yourself? My name is Alexei, and I represent Victoria Charitable Foundation. So what we do, we work with resocialization of ex-prisoners. So I have a question. In our country, resocialization program means that adaptation of ex-prisoners in society. So people who for whom alternative measures are implemented, and we have a problem here. So a person who has not served the sentence yet, they have a number of issues they are facing. At the same time, there is a number of social standards based on which services are provided, but the person is not able to get employed because he has a criminal record and has not served the sentence yet. So officially, employers should not request a criminal record certificate, but in fact they do. And if the person wants to get employed and has this criminal record plus is registered with drug treatment facilities, there is a huge problem. So like formally, according to legislation, everything is fine, but in practice, people are facing problems. So I would like to know how those things are resolved in Europe, and what can we do to help those people and prevent them from going back to detention facilities and to prisons because of this
English,
problem.
please use the Russian channel to listen to my to answers. Actually, it's much broader. This criminalization and criminal record as a key obstacle for socialization. That's the big obstacle, not only for women using drugs. I would suggest now to stop discussion because we have limit of time and we're already 20 minutes past the end of the discussion, and we promise that will not end with this side event for CND, but we will have broader discussion with the possibility to listen to the experience of different centers. And now I'm happy to provide a word to our speakers if you have something to answer the questions or to react on the feedback from participants and some replicas. Please, Vika wanted to say, I know, but maybe some other speakers want to have summarizing few sentences. Please, Vika, Victoria.
Yes, so I would like to use this opportunity to tell thank you to Vitaly, who elevated really important topics. That documenting only for documenting doesn't make any sense, and we clearly understand this when we implement React, and we try to ensure adequate response on the individual level. That is very important part of our work, and we try our best to ensure this response. Of course, there is never too much of legal support, of social support. Our clients, they need more and more, and there is no limit of that support that can be provided to people. So the point in React is that we're trying to solve cases on individual level, and like more than the half of all the cases are responded by reactors. The problem is that a lot of clients want to receive this help. They are not ready to fight for their rights, to claim for their rights. So that is the biggest problem. And I'm pretty agree with you that we need to improve knowledge of reactors, and also we need to improve knowledge and skills and self-esteem of our clients, and to prepare them and to support them to fight for their rights, using opportunities React and a lot of projects provide them. So this very important issue you raised up, that services, especially legal services, human rights protection services, have to be broader and more effective and more easier to reach out in our regions. That's for sure. We try in React to do our best, and we encourage for further cooperation between our other projects to ensure complex and joint effort in the region.
And actually, here in the panel, we have several experienced experts in providing different help. So it's not only legal support, but also social support, organizing comprehensive help. And I know that Galia Kornienko won't also step in, but I will not let you in, Alechka, because we need to finish the session, and we will have specific discussion on the recommendation and best practices, I promise you. Please, maybe other speakers want to summarize their vision or some final remarks on the session, please. Sveta, Maria, Alla, do you have? No? Or Sveta, something to say? Yes.
Can I speak Russian? Is that okay? Can you hear me? I would like to summarize a little bit about the empowerment of women who use drugs and their engagement in response to domestic violence cases and interventions aimed at preventing those situations that we discussed. I am convinced that women should be in the focus of response to violence, response to HIV, and human rights protection, because that is about their health and their lives. And I think that our efforts should be aimed at empowering those women so that they can unite, and so that they can raise their agenda, so that they can develop the interventions that they can benefit from, because they know their situations better than anyone. So summing it up, I would like to support investment in women, investment in human rights activists, women, paralegals who know how to work in the field, how to respond to crisis situations related to human rights violations, to build their capacity and to make sure that they can get as much resources as we can give them to respond to criminalization and stigmatization. Thank you for giving the floor to me.
That's the best final words in our session we could have. And we are really working to have this in reality, not only in the CND sessions. And thank you everybody who joined us and stayed with us even longer than we planned. Thank you for this discussion, and we will be happy to see you all further on in our discussions, more particular, more operational, to ensure all the services and proper reaction on the violence and human rights violation against women using drugs in our region. Thank you very much, and have a good evening, have a good afternoon or morning. See you around. Thank you.
Thank you very much, Alla, Sveta. Thank you.